the situation is certainly much worse than what we see in the official stats. I just need to also explain that when we look at the stats, official stats from China, confirmed cases are calculated differently or separately to asymptomatic cases, which means that asymptomatic cases are calculated on a different chart, so they don't appear in the same chart as the confirmed cases. So the confirmed cases in Beijing, for example, right now, the official figure is over 2,000 new confirmed cases a day. But we know it's, of course, way more than that. So, for example, Baidu has conducted some survey on the internet and found that 40% of the Beijingers or Beijing population are being infected. And some netizens have also conducted surveys on Weibo as well and finds a very similar figure.
So what does it say about how the government's reporting before it dropped its zero COVID policy compared to now?
A good question. So certainly the asymptomatic cases have increased, and to such a point that from the 14th of December, the Chinese government has stopped reporting on asymptomatic cases, saying that because most people are now being tested through rats and they're not really reporting the cases. So now the government has stopped reporting on the asymptomatic cases. But I just would like to explain, asymptomatic cases do not mean that those people are not infected. They are. It's just that they haven't shown symptoms as the figures were being collected.
And as you mentioned, you can kind of gauge how bad it is in China by the number of people in hospital, businesses not being able to operate due to illness, delivery services, for example. We're hearing a lot of stories about that.
Yeah, absolutely. And also, basically, COVID is the only thing that the netizens are talking about on the internet now, because every day you see people getting infected. You see colleagues and friends every single day. And also netizens are sharing their experiences in COVID to basically help one another about what this Omicron looks like, what the symptoms are, and also to help each other not to panic.
Do you get a sense there's also some confusion given the government's messaging has changed as well? What was it telling citizens about the severity of the disease before reopening, and what's it saying now?
Yeah, absolutely. That's a very interesting question, because under the strict zero COVID policy, then the public messaging is that the public messaging is that COVID is really something serious. It has severe side effects and also have severe symptoms. So that's what the impression that the people get. But now, because there was this U-turn of the policy to opening up, and then the netizens and citizens really need to relearn what Omicron is and what COVID is. And most of them don't really have experience, don't really have any sense of what the symptoms might look like, and also what the side effects might be.
And are they being advised now to go to hospital or not if they've got COVID?
Well, they've been advised. If we look at the new measures the Government State Council issued on the 7th of December, there are stipulations as to say that if you have mild symptoms or if you don't have any symptoms, please stay home. You don't need to go to the hospital. So there have been a lot of advice to the citizens to really re-look at the COVID and also not to panic. But still, many people still choose to go to the hospitals because GPs are very rare in China. And people just have this habit of going to the hospital if they have a fever.
So how are hospitals coping with the surge in patients then?
With great difficulty. So the hospital's been educating the general public as well. If you have mild symptoms, if you don't have any symptoms, you don't really need to come to the hospital. And also in the 10 measures that the government issued on the 12th of December, there were also stipulations as to say that health services really need to give the elderly people and the children priorities, and also people with severe diseases to be given priorities in the hospital for treatment.
Now, Delia, experts say almost 1 million people could succumb to COVID in China. How accurate do you think these estimations are?
Well, it's actually not that difficult to estimate that number. Because if you look at the case in Shanghai, as I've mentioned, just based on official numbers, the official total confirmed cases in Shanghai is just above 65,000. Those are the confirmed cases. But as I've mentioned, that asymptomatic cases are calculated separately. And officially, if you combine asymptomatic cases and confirmed cases, then we're looking at about 600,000 actual cases in Shanghai, and the death reported are about 600. So we're looking at about 0.1% of fatality rate. And if we say, well, some government officials have said that by when China reaches the peak around March or April next year, it could be 90% of the population could be infected. But if we just use Shanghai's figure, 0.1% of death rate, then we'll be looking at over 1 million.
Well, Delia, thanks for breaking those numbers down for us. Really appreciate you talking to us. Thank you so much.
Thank you.